Hello, and welcome to the third phase of your case, the medical management phase, also sometimes referred to as the treatment phase. Now, this phase is the largest, longest, and most important phase in your entire case, because this is the phase where you work on getting better. Now, this phase can last a really long time depending on the facts. For some clients, it lasts 2 or 3 months. For some clients, it can last over 2 years. But during this phase, you're going to be focused on getting better. And that means following your doctor's advice, going to all of your appointments, and doing everything that you can to get better. Because let me be honest with you, there is no amount of money that is worth your health. And our goal for every client is to get them as better and recovered as possible. Sometimes that means you get back to 100%. Sometimes it means you get as close as you can, but you have to live with a permanent injury. But this is the phase where you focus on getting better. Now, during this phase, what we're going to be doing is a handful of things. First, we're going to be ordering all of your medical records on a periodic basis so that we can see what your doctors are diagnosing you with, what the treatment plans are, how they're working, and if there's any recommendations for other types of care. Most doctors do a great job and will do their best to get you better. But every now and then we look at some of the medical records and we wonder, why aren't they doing this or why aren't they doing that? So this also allows us to make suggestions like, hey, you haven't gotten better after 3 or 4 months. It might be time to get an MRI or some other type of imaging, or maybe we should try a different modality. If chiropractic isn't working, maybe you should try physical therapy or vice versa and other things like that. Additionally, during this phase, we're going to be calling and you'll be speaking with one of our pre-litigation paralegals every 2 months or so to get an update on your case. We'll ask you a lot of questions about how you're doing. How are your pain levels? How's the treatment going? What's working? What's not working? How has these injuries impacted your life? Are you getting better, staying the same, or do you feel like you've plateaued? These 30-minute calls are incredibly important, and honestly, it's part of CGH's secret sauce to maximize your settlements, is to gather information from you all throughout your case, rather than just waiting till the end. Now, also what will be going on in this case is we'll be deciding when to send the demand letter or move you on to the next phase. Now, this is one of the most important questions that were asked, and so this part is particularly important. We will only move your case on to the next phase when one of 3 things occurs. 1, you make a complete 100% recovery, which we hope happens for you. 2, a doctor puts in writing that unfortunately you have a permanent injury and that you will never make a 100% recovery and that you've reached what's called MMI, or maximum medical improvement, which means that at least with current medical technology, you are as good as you're going to get. Now, you may still be doing care to maintain that level and not get worse, but at least in that doctor's opinion, this is as good as it gets. Or 3, your damages clearly exceed the available insurance coverage. If you're really damaged and there's not that much coverage, then this may happen earlier. And it's when one of those 3 things happen that we can move you on to the next phase. And that's why this phase is so variable. For some clients, it lasts 2 months. For others, it lasts 2 years. But our goal is always to get you every dollar that we can